1. The proper procedure for washing the female resident's perineal area is to A. Clean from front to back. B. Clean the rectal area last. C. Pat dry thoroughly. D. Do all of the above. The correct answer is D. Do all of the above. 2. Frequent mouth care should be given to residents who A. Receive oxygen therapy. B. Are unconscious. C. Receive tube feedings. D. All of the above. The correct answer is D. All of the above. 3. Using the base method, a patient's teeth are to be brushed A. Up and down. B. For at least 10 minutes. C. With circular motions. D. All of the above. The correct answer is C. With circular motions. 4. When a resident complains that his dentures are hurting, you should A. Encourage him to wear the dentures more often. B. Report the complaint to the charge nurse. C. Report the complaint to the physician. D. Put the dentures on the bedside table. The correct answer is B. Report the complaint to the charge nurse. 5. The first thing you should do before giving a patient a tub bath is to A. Make sure the tub is clean. B. Check the temperature of the water. C. Make sure there is an order for it. D. Gather necessary supplies. The correct answer is C. Make sure there is an order for it. 6. The resident's religion forbids eating pork. Ham is being served for lunch. You should A. Tell the resident to eat it because she needs protein. B. Tell the resident it's all right since her doctor ordered the diet. C. Ask the nurse to call the kitchen. D. Tell the resident that restrictions don't pertain in times of illnesses. The correct answer is C. Ask the nurse to call the kitchen. 7. It is important to remember that dying residents A. Have the same needs for care as other patients. B. Need to be by themselves in a quiet room. C. Do not need to be consulted regarding their care. D. Are usually in pain. The correct answer is A. Have the same needs for care as other patients. 8. Dying residents and their families A. Always pass through 5 stages of dying in order. B. Always accept death before it occurs. C. May go back and forth among the 5 stages. D. Must go through all stages of dying before they die. The correct answer is C. May go back and forth among the 5 stages. 9. A sign of dementia in elderly patients is A. A need to eat regular meals. B. Not knowing who and where they are. C. An ability to figure out problems. D. A good memory for recent events. The correct answer is B. Not knowing who and where they are. 10. Residents with Alzheimer's disease may show which of the following signs or symptoms? A. Physical and mental wasting away. B. Extremely clear memory. C. Frequent pacing or wandering. D. A. And C only. The correct answer is D. A. And C only. 11. When a patient turns on the call bell every few minutes, the appropriate response is to A. Ask the patient not to call so often. B. Stop by the room more often. C. Place the call bell out of reach. D. Tell the patient how busy you are. The correct answer is B. Stop by the room more often. 12. Many older adults suffer loss of A. Income. B. Physical strength. C. Loved ones. D. All of the above. The correct answer is D. All of the above. 13. How a patient reacts to illness and disability is most dependent on his or her A. Age and stage of life. B. Spouse's support. C. Income and level of education. D. Support system and life history. The correct answer is D. Support system and life history. 14. An 85-year-old resident tells you that his mother is coming to visit. Your best response would be A. That's impossible. Your mother can't come to see you. B. That's nice. When is she coming? C. Tell me how old your mother is. D. Are you wishing you could see your mother? The correct answer is D. Are you wishing you could see your mother? 15. In the long-term care facility, the family members should be asked to A. Leave during treatments. B. Attend care planning meetings. C. Avoid visiting during mealtimes. D. Help perform patient care. The correct answer is B. Attend care planning meetings. 16. Sexuality in long-term care patients may include all of the following except A. Needing private time with a partner. B. Caring about one's physical appearance. C. Engaging in public fondling. D. Desiring sexual interaction. The correct answer is C. Engaging in public fondling. 17. A patient hits you during lunch. You should A. Call the charge nurse for help. B. Continue to feed her. C. Apply a restraint. D. Yell at her to stop hitting you. The correct answer is A. Call the charge nurse for help. 18. The nursing assistant must report abuse of a resident by A. The family. B. The staff. C. Another patient. D. All of the above. The correct answer is D. All of the above. 19. A cane should be used on A. The affected or weak side of the body. B. The unaffected or strong side of the body. C. The side with the strongest arm. D. The weak side one day, strong side next day. The correct answer is B. The unaffected, strong side of the body. 20. When using crutches, the resident's weight must rest on the A. Armpits. B. Spine. C. Handrests. D. Knees. The correct answer is C. Handrests. 21. A walker may be used if the resident can A. Support some weight. B. Use her hands well. C. Balance without help. D. Walk independently. The correct answer is A. Support some weight. 22. Correct range of motion, ROM, for the neck includes A. Pronation, supination, flexion. B. Rotation, abduction, adduction. C. Abduction, adduction, flexion, extension. D. Flexion, extension, rotation. The correct answer is D. Flexion, extension, rotation. 23. Which of the following statements about range of motion, ROM, is false? A. Active ROM means the resident does the exercises. B. Passive ROM means the nursing assistant does the exercises. C. Active ROM means the nursing assistant does the exercises. D. Active ROM is best, if possible. The correct answer is C. Active ROM means the nursing assistant does the exercises. 24. If the patient is in traction, you should never A. Monitor affected skin temperature. B. Give a total bed bath. C. Change the position of weights. D. Monitor distal pulses. The correct answer is C. Change the position of weights. 25. To transfer a resident correctly from a bed to a stretcher, you must A. Use good body mechanics. B. Use a Hoyer lift. C. Use at least 6 co-workers. D. Raise the far side rail of the stretcher first. The correct answer is A. Use good body mechanics. 26. If the chains on a mechanical Hoyer lift with a chair-type seat are uneven, then the A. Shorter end goes toward the patient's feet. B. Shorter end goes toward the patient's head. C. Lift cannot be used. D. It does not matter. The correct answer is B. Shorter end goes toward the patient's head. 27. When a resident with a cast complains of itching, the nursing assistant should A. Wash the exposed skin and pat dry. B. Discourage the resident from scratching. C. Report it to the charge nurse. D. Do all of the above. The correct answer is D. Do all of the above. 28. Which statement about mentally handicapped patients is correct? A. They usually have no ADL skills. B. They are usually bedbound. C. They can learn, but at a slow pace. D. They are dangerous, because they are always strong. The correct answer is C. They can learn, but at a slow pace. 29. When helping a resident use a walker, you should tell him to A. Move the walker and his feet at the same time. B. Move the walker, place the walker firmly, and step. C. Move the walker, and then slide his feet. D. Take several steps, slide the walker, and then place the walker firmly. The correct answer is B. Move the walker, place the walker firmly, and step. 30. The purpose of correctly positioning the patient is to A. Prevent skin breakdown. B. Maintain function of joints and muscles. C. Increase comfort. D. Do all of the above. The correct answer is D. Do all of the above. 31. To move a resident with a fractured hip, you would A. Roll her toward the affected side. B. Roll her toward the unaffected side. C. Use an abduction pillow. D. Check the physician's order. The correct answer is D. Check the physician's order. 32. The most important goal of bladder training is to A. Decrease the cost of care. B. Stop urinary incontinence. C. Prevent embarrassment to staff members. D. Reduce bed changes. The correct answer is B. Stop urinary incontinence. 33. Which statement about bowel and bladder training is correct? A. It should always be completed within 2 weeks. B. It should include every person on the healthcare team. C. It should include the use of diapers to prevent embarrassment. D. It is necessary for all residents. The correct answer is B. It should include every person on the healthcare team. 34. Security for a resident's dentures includes A. Keeping them in a tissue in a dresser drawer. B. Placing them in a label denture cup. C. Insisting the resident wear the dentures. D. Placing an identifying mark on the dentures. The correct answer is B. placing them in a labeled denture cup. 35. If family members bring new clothes in for a resident, you should make sure the A. Clothes are put in the resident's dresser drawers. B. Clothes are labeled with the resident's name. C. Family removes an equal number of old clothes. D. Charge nurse sees the clothes. The correct answer is B. Clothes are labeled with the resident's name. 36. The charge nurse instructs you to clean a resident's closet. You should A. Throw away all torn clothes. B. Ask the family to come do it. C. Enlist the help of the resident. D. Tell the nurse you are too busy. The correct answer is C. Enlist the help of the resident. 37. Before dressing a resident, you should A. Close the door and pull the curtain. B. Choose the proper clothes. C. Check for a doctor's order. D. Do all of the above. The correct answer is A. Close the door and pull the curtain. 38. Confidentiality refers to A. Never sharing information with anyone. B. The right of the patient to privacy. C. Only sharing information with those involved in the resident's care. D. Both B and C. The correct answer is D. Both B and C. 39. A patient's dentures are lost. You should A. Notify the administrator. B. Look for them. C. Notify the doctor. D. Notify the charge nurse. The correct answer is D. Notify the charge nurse. 40. As a nursing assistant, it is your responsibility to A. Plan the resident's care. B. Do the tasks the supervisor assigns to you. C. Do the best you can without asking for help. D. Compare assignments with your co-workers. The correct answer is B. Do the tasks the supervisor assigns to you. 41. Maintaining good interpersonal relationships depends on A. Going along with the crowd. B. Communicating clearly with others. C. Following orders without questioning. D. Doing all of the above. The correct answer is B. Communicating clearly with others. 42. If you do not know how to do an assigned task, you should A. Call another nursing assistant for help. B. Ask the patient how she prefers to have it done. C. Call the charge nurse and ask for help. D. Follow the instructions in the procedural manual. The correct answer is C. Call the charge nurse and ask for help. 43. Reporting exactly what you see is an example of what observation? A. Clinical. B. Objective. C. Personal. D. Subjective. The correct answer is B. Objective. 44. When caring for a resident who has just been placed on NPO, nothing by mouth, you should A. Encourage the patient not to think about food and water. B. Encourage the resident to eat and drink. C. Remove the water pitcher and all items of food and drink. D. Give the patient meticulous mouth care. The correct answer is C. Remove the water pitcher and all items of food and drink. 45. The purpose of using restraints is to A. Position an atrophied extremity. B. Protect the resident and others from injury. C. Prevent wandering in the halls. D. Do all of the above. The correct answer is B. Protect the resident and others from injury. 46. Failure to raise the side rails on the bed of a confused patient is an act of A. Malpractice. B. Negligence. C. Overt commission. D. Breaking a criminal law. The correct answer is B. Negligence. 47. During a job interview, you should tell the interviewer about your A. Scheduling needs. B. Childcare needs. C. Qualifications. D. All of the above. The correct answer is C. Qualifications. 48. When you are unable to work due to illness, you should A. Arrange for someone to cover for you. B. Call the facility as early as possible. C. Call your charge nurse an hour before your scheduled time. D. Notify the facility at least 30 minutes before your scheduled time. The correct answer is B. Call the facility as early as possible. 49. The primary reason for laundering a nursing uniform after each day's wearing is to A. Look professional. B. Look neat. C. Remove body odor. D. Prevent the spread of germs. The correct answer is D. Prevent the spread of germs. 50. Decubitus ulcers may develop in patients who are A. Incontinent. B. Paralyzed. C. Poorly nourished. D. All of the above. The correct answer is D. All of the above. 51. A water pitcher has tipped over, and you notice water on the floor. You should A. Wipe it up immediately. B. Throw a towel over the water to prevent accidents. C. Notify the charge nurse. D. Call housekeeping. The correct answer is A. Wipe it up immediately. 52. For a resident who is classified as wound and skin isolation, the soiled linen should be A. Placed in the linen hamper. B. Discarded. C. Bagged before removing from the room. D. Taken directly to the laundry. The correct answer is C. Bagged before removing from the room. 50. Decubitus ulcers may develop in patients who are A. Incontinent. B. Paralyzed. C. Poorly nourished. D. All of the above. The correct answer is D. All of the above. 54. If your resident begins to choke while being fed and is unable to speak, the nursing assistant should call for help and begin doing A. Back blows. B. Mouth-to-mouth ventilations. C. A finger sweep. D. Abdominal thrusts. The correct answer is D. Abdominal thrusts. 55. When you make a bed, you should place the soiled linen A. On the bedside table. B. On the overbed table. C. In a laundry bag. D. On a chair. The correct answer is C. In a laundry bag. 56. When making an occupied bed, it is important to A. Make half of the bed at one time. B. Have one side rail up and one down. C. Make a toe pleat in the top covers. D. Do all of the above. The correct answer is D. Do all of the above. 57. You can prevent decubitus ulcers by A. Changing the patient's position frequently. B. Placing an egg crate mattress on top of the mattress. C. Increasing the patient's vitamin C consumption. D. Doing both A and B. The correct answer is D. Doing both A and B. 58. After positioning a patient, it is most important to A. Examine the resident thoroughly. B. Close the door to the resident's room so she can rest. C. Offer the patient a drink of juice. D. Check the position of non-functional limbs. The correct answer is D. Check the position of non-functional limbs. 59. The first step in getting a resident up to walk is to A. Sit the resident on the side of the bed. B. Put the resident's slippers on. C. Check the activity order. D. Tell the resident what you want him to do. The correct answer is C. Check the activity order. 60. As you are transferring a patient, the resident becomes weak and starts to fall. You should A. Hold the patient's transfer belt and lean away from the fall. B. Call for help. C. Grasp the transfer belt and lower the resident to the floor along your bent leg. D. Hold the resident tightly and lean backwards. The correct answer is C. Grasp the transfer belt and lower the resident to the floor along your bent leg.